Hi, Keisha. This is Amanda. I dialed in by phone and my audio wasn't seeming to work on my computer. Can you hear me okay now?
I can.
Okay. It must be an issue with my computer audio.
Oh, glad you're on. All right. Just sending a note to everybody online to just reminder to mute their phone when they're not talking so we can avoid background noise. Okay, great. All right, let's go ahead and get started. Good afternoon, everyone. This is Keisha Pollock. Thank you for calling or being part of the PAPRN Plus call. It's great to see a number of people. We had heard that July wasn't a great month for folks, but we decided to have a call anyway, and I'm really excited to see a number of people online and on the phone. So welcome to today's call. I don't anticipate we'll take the full hour, but we will. We have the time and look forward to some great updates from the Coordinating Center and the working groups. And we will begin as we normally do with our updates from the CDC. And I know Tom is on, and Tom, let me ask if you could provide any updates to the group.
Yes, I think last time I was very equivocal about our funding status, and in between that then and now I had some nightmares. I think right now I can sleep pretty well that next year's funds are in the pipeline and should be coming through. So that's good news. Also, I think most people know we have a new director at CDC. Her name's Brenda Fitzgerald. She's an OBGYN who was the director of the public health here in Georgia. She seems to be aligned pretty well with some of our interests. She's one of her keystone programs was working in schools to promote physical activity with youth, and she's also very much into sort of brain health and especially low-income kids and getting them to have interactions with their parents, reading and those kinds of things. So she's new to us, but so far the wind seemed to be going in a good direction. Just to remind people, I think I'd mentioned before, we want to build on the dissemination implementation work that PAPRN and America Walks has done. So we're going to put in a proposal to NCORE to build on that with a slightly more youth focus, because that's what NCORE's interests are. At the current way we're looking at it is maybe to look at 2 to 3 programs that exist that are fairly well, that have at least been in the field and evaluated to some degree, then to try to understand how to operationalize what makes that program that program. So we're thinking of 2 meetings, one to quote operationalize or define how to do that with programs, and the second would be how to disseminate these programs in rural communities. So the overlying theme is rural with the idea of dissemination and implementation. The ultimate aspirational goal would be to have some that were ready to be competitive for NIH funding. 2 of the potential ones we've been talking about is which is the youth advocacy program. It's part of the PARC study. And then also Play Streets, which is also part of PARC and now maybe part of PAPRN as well. If people have an idea for a third kind of programmatic effort that's well-defined, well understood, and that they're engaged in, let me know about it. Because I think 3, something like a safe routes, a shared use, something with a little bit of a policy taste to it would be great. And then 2 more just really quick. I think people know the community guide has released their recommendations around built environment, and that's been very good for us because we took us 3 years to go from the original recommendations to the new review. And then finally, I just want to recognize at least 2 of the folks that have got a pubs that have just come out. Arizona, Arley had one came out about a month ago, and then UMass sounds like last week or even a few days ago had one of theirs accepted for publication. So thank you guys. That's it.
Great, thanks, Tom. And just really appreciate those updates. And just to clarify, so you're about the program you're looking for, the third one. So you're looking for a more policy-focused, rural, any particular populations you're aside from younger kids? Can it be sort of any low income, any racial and ethnic group, or
anything that we've got an expert involved in that is somewhere middle along a pipeline towards dissemination? Because what we want to do is have an exercise of how do we push these further down that pipeline? What are the strategies to do that?
Okay, terrific. Let me pause and see if anybody has any follow-up questions for Tom. Okay. Hearing nothing, let me just say, please, I encourage you to reach out to Tom if you have suggestions for a third project. And Tom, thanks for calling out those papers from recently publications from PAPRN plus funded projects. So congrats to Arlie and to Stephanie and team. Great job. Okay. So let me move on just to some other updates from the coordinating center, and we have a few. The first is that I want to remind everybody that abstract submissions are open for the 2018 Active Living Research Conference in Banff, Canada. The conference is from February 11th through 14th. And abstract submissions are due in about a month, so August 24th. I just want to remind people that they're looking for oral and poster presentations around research.
Actually, that would be.
Oh, sorry. Can you unmute your phone, please? Thank you. Around research and practice and policy around active living. And maybe I'll pause there and see if Amanda has anything to add about ALR. I will, before I do that, I will say that we are exploring or what we will do in terms of a network. Many of us from PAPRN Plus tend to attend ALR. And so, you know, like in prior years, we will do something. And so that remains to be planned. But let me see if Amanda has anything else to add about the ALR conference.
Yeah, I think you mostly covered it. The theme of this year's conference is future-proofing activity application across sectors. So we're trying to think about how we can use technology to continue to promote physical activity and not be at the cause of decline for physical activity. So abstracts do not have to be related to the theme, though, so you can submit on anything related to active living. If you have questions about an abstract or something you're thinking about, feel free to email me, but otherwise I hope to see most of you there.
Great, thanks, Amanda. So speaking of conferences, many of you know that the APHA conference is coming up very soon. It is in Atlanta this year. For those of you who have not yet made your reservation or who haven't planned yet to attend, and it starts a pre-conference workshops, I think, are on November 4th, but the conference is from November 5th through November 8th. And I'm going to mention that we are going to be asking individuals who are presenting to let us know, and Eric from the Coordinating Center has offered to or agreed to sort of coordinate that. And we want to compile a list and make sure we get that out to everybody so you can support various presentations. I will just put a plug in for Monday, November 6th. There will be a session, and the first one from 8:30 to 10 that features papers from each of the collaborating centers. And so Tom is going to moderate that for us, and so we're excited for that session. And again, this will be part of whatever communication we send out to the network, highlighting presentations from APHA. And in the minutes for this call, we will include a link or maybe some sort of Google Doc or something where people can list their presentations that then we can share with everybody so that they know work that's being presented by members of PAPRN Plus. Eric, do you have anything else to add on that point?
No, just to follow up with our next point that kind of transitions well into it with the activity update.
Okay, great. Well, maybe I'll let you go ahead and do that. I think you and Amanda are doing that one, maybe.
Yeah. So again, this is Eric Schulman. I'm the Communications Associate here at Hopkins, the Coordinating Center of PAPRN, and I'm going to pull up the activity update Google Doc that I believe was shared last month, but it'll also be included in the notes from today's call. So I believe you should be seeing it now. If anyone doesn't, please just let me know. So as you can see on this Google Doc, it's basically a space where any network members, whether part of the collaborating center or working groups, can include information on upcoming work that they have that might be considered for communication on the network, social media channels, or on the website, or any other communications we might be doing. So whether that's that you have a poster at an upcoming conference or presentation or a journal article that is in press or will be coming out soon, this is a place where you can go in, plug in any information that you have for that activity, and I'll be monitoring it, and I believe others from the coordinating center will be monitoring it just to make sure we're up to date, especially for the website, where we would just want to show off and feature all the great work that we're doing. This is a way to, harvest all of that and make sure it's all represented. And I believe on a monthly basis, we'll be sending out, moving forward, reminders for network members to send updates to the Google Docs. So right now you can see the Collaborating Center tab with all the different columns for information, whether it's publication or presentation, where it's taking place, if there are links available, any notes you might have, and then also a working group activity tab as well. So again, I believe this was sent out, the link to this Google Doc was sent out earlier, but we're happy to include it in our notes from today's call.
Yeah, thanks for that, Eric. And maybe just one thing to add. I know a lot of you have received our frantic last-minute emails asking for updates. Tom a lot of times gets requests from CDC with short timelines, and so we're hoping that this spreadsheet can be a way to track our progress and communications items so that we have a place to go to for that, and something that Tom can also access if he needs to kind of show off the work of the PAPRN network and kind of let people know what we've been doing. And so I'm hoping that it will be a way to avoid some of those last minute urgent requests.
Yeah, thank you so much, Amanda and Eric. And Amanda, I cannot underscore that enough, that this is really going to be helpful for Tom when he gets asked to put together a brief update on PAPRN Plus. That he can go to this document and look and see what's happening in terms of activities. And so we just encourage all of you, whether you're at funded centers or not, to really just, let us know when you are doing work related to your work group, or if you have other projects coming out or anything. We just would love to keep a track of it. So we can access it. We'll be looking at it regularly, and we'll just encourage you, to remember to update it. And if we don't hear from you, we'll nudge you a bit sometimes. But really thank Eric and Amanda for getting this going, so that way we can continue to use it in the future.
Yeah, let me just interject. This is probably part of what saved my concern about where the funding might go. It was truly on the table, and this spreadsheet showing the broad range of both things going on and things coming up in the future helped cement our place and our life for next year. So keep adding to it, please.
Yeah, thanks, Tom. Thanks for saying that. Things were certainly questionable in terms of funding, and so we are grateful that we'll have another year of funding. And I think we just need to continue to show our activity and how productive we're being. Again, whether it's presentations or talks or papers or other types of products, we just would love to know what's going on. So.
And I would just say that nothing is too small. So, there might be things that you think are not relevant, but any kind of, meeting or thing that you are doing to promote the PAPRN network, or work that you're doing that you've, used you go present at town hall or something. So don't be afraid to brag a little bit.
May I ask this is Jamie, Keisha, can I ask a question that may have been on the prior discussion you were mentioning about conferences. With APHA, as some of us are trying to figure out our travel plans, is PAPRN planning anything with us getting together at APHA, or does anybody know about the PA section when their social events will be happening and meetings so we can coordinate?
Yeah, great, Jamie. Thank you. So we, in the past, have done with PAPRN, and so we've reached, nothing's planned yet. When it last year or last Sunday evening, but we are trying to figure out something that we can get together socially. So I will certainly I'll try to confirm that in the next year or two. But we have we're trying to leverage sort of what the PA section is planning and or PAPRN to do something.
Okay, thank you.
Well, yeah, while you raise the question, maybe I can also make suggestions for days. I mean, do people have preferences on which day of APHA would be best? I know not everybody plans to arrive on Sunday, so perhaps Monday would be best, although I know it's a very busy, but just wanted to see what folks thought to move up to this point.
I don't know about everybody else. That's why I was asking the question, because like it looks like all my things are Sunday and Monday.
Okay.
And so I was debating leaving Tuesday, but I'm not going to leave Tuesday like if there's PAPRN related stuff. So
yeah,
but other people probably have Tuesday and Wednesday stuff. So
yeah, well, we'll try to figure out the time that works best for most people. Yeah, we're trying to firm that up. So thanks for raising. I just didn't mention it because I didn't have any solid plans yet, but thanks for, it's good for everybody to know we're trying to get something together.
Great, thank you.
You're welcome, thank you. Okay. Are there any other questions or comments on tracking system or anything else that was shared just now? All right. Well, let's turn it over. Let's head to our next agenda item, which is the working group update. And I just want to say how thrilled I am and excited to hear about all of the activity that the working groups have been doing, and really want to thank Amanda for all of your continued support of the working groups and for just everything that you're doing to help support the leaders and to keeping them moving forward. And I will turn it over to you to sort of facilitate this part of the agenda where we will sort of get an update on what each of the groups are doing. So let me turn it over to Amanda. Amanda, I wonder if your sound is not working or if you're on mute. Okay. All right. Well, I can certainly get us started. And I know Amanda has coordinated with each of the working groups in terms of the order for the presentation, but I will maybe just work off of this slide unless folks know differently. Oops, hello? All right, so let's go ahead and get started and begin with the Complete Streets group. And I think each group was going to give a brief update, and then we would also have some time for questions. And so over to the Complete Streets group.
Arlie, do you want me to?
I would say, Jamie, jump right in. I do not have much to report as an update.
Okay, so I think our group has been struggling as a whole. I think partly because Arlie and I are both very overwhelmed, overloaded with lots of things on our plates, like everyone probably on the call is. For the qualitative analysis of the Complete Streets Equity transcripts, it's where it got stalled because of me. So I'm putting out an ask to see, and Keisha, haven't really reached out to Amanda, but I think I need somebody to help keep me on task and to make sure we move this along. Amanda really hasn't, we haven't really interacted with Amanda much in a long time for this work group, and I think she just felt like we had it under control, but I need somebody to keep me on task to get this stuff done and out the door. And so if Renee and anybody else who is working with me on that activity, if you're still interested, please let me know. And I still really want to get it finalized and finished. I just need somebody to help push me along and make this a higher priority.
Sure. And so, Amanda, I don't know if you hop back on. Can you
hear me? I think I'm on mute though.
No, we can hear you now.
Yep.
Oh, good. Okay. I got kicked off, but I am back on now. Sorry about that.
Okay. Oh, great. No problem. No, glad you're here. I was just going to jump in and say, Jamie, we certainly can maybe we can have an offline conversation and sort of think about a timeline. And I know Renee's not on today. She's on vacation this week, but you know, we can certainly get together and think about that work, and
that would be great.
And so I would sort of let's find some time to get a call together just to figure out a timeline, because I think it's a terrific project.
Yeah.
It would be great.
Yeah, I agree. I don't want to let it go. So I want to get it done, but I just need some support in helping to structure and organize it and get it done. So yeah, so I'll correspond with Amanda, I guess, offline and figure out when we can schedule a call. That would be really helpful.
Yeah, that sounds great. And I'd love to be on the call too. So yeah,
that'd be great.
Excellent.
And then, Arlie, I don't know if you have much else to add other than what I already said.
Yeah, no, I would agree with that. And yes, I think that, yeah, you and I probably also should have a conversation offline. And yeah, I've got a couple of things sort of bubbling beneath the surface that coming this fall should be good activities for this group potentially.
Great.
Hi, this is Kate Joyce from the Shawnee Senior Center in Shawnee, Oklahoma, and I've been on the Complete Streets group. But what I wanted to say is we're at the end of our phase 1 for initiating Complete Streets, and I was wondering if maybe we needed to talk offline about how to get some information and pictures and data and stuff to you, or we're getting ready to initiate phase 2. I think we're planning on starting in September. So
that would be wonderful.
So I would like to visit with someone, and I think Amanda has all my contact information because sometimes I make a nuisance of myself. But
we welcome it. So maybe, Amanda, we can factor that into our offline conversation and figure out what makes most sense.
Sure.
Thanks.
Thank you.
Yeah, that sounds great. Thank you. Amanda, I just jumped when I couldn't hear. I just went. So I don't know. I'll turn it back over to you to finish this part, but let me know if you want me to facilitate this.
Sure. Sorry about that interruption. The next working group we were going to have an update from is the older adults group, and unfortunately, Katie had a family emergency come up. She was going to give the update, but she did send us some notes. So I just wanted to give the updates on her behalf for the older adults group. So she wanted to mention that the Complete Streets subgroup is working on the manuscript on language about older adults in Complete Streets policies. I know that's been ongoing, and Jana is the lead for that. The update from the outdoor physical activity subgroup is that they are actually collaborating with Jordan Carlson and his team on a survey of walking school bus programs. So they're looking at kind of this intergenerational idea of having older adults help with walking school bus programs, and they've been in contact with the Safe Routes to School National Partnership about that. So it's a great project moving forward with direct connection with a policy and advocacy group. They have, for that survey, contributed some items related to older adult volunteers. And so that survey is under development now and should be ready for pilot and distribution in August and September. So those are the two core projects with the older adults group.
Great, thanks, Amanda. Maybe I'll just make a plug that if anybody on the phone is not connected to a working group, or especially after hearing updates and you'd like to be, please let us know. We're happy to connect you with the group so that you can get plugged into their calls and could potentially be involved in these ongoing projects or definitely new things that are being formed.
Great, thanks for that, Keisha. I always try to make that plug. And so the next group I think we have to update is Parks and Recreation.
Okay. Hi, Amanda, it's Sandy. I think I'm giving the full update. Jeanette has a health-related issue that came up today, so it's just going to be me. So we have a total of 4 up and running subgroups right now under the Park and Recreation Working Group, and we have 1 more that that we're working on getting up and running. So just to give you some updates, our first subgroup is a physical activity and connection with nature subgroup, and so far they've had a total of 2 meetings where they've discussed different ideas to work on. This group is being led by Rich Christiana, and they're really discussing what's needed to further the nature and health movement within public health. So they've been looking at 2 issues. One is the need for health insurance companies to reimburse providers for taking time to talk to patients about spending time in nature, and the lack of the involvement from the public health field in researching exposure to nature and health outcomes. Then they've got a couple of different project ideas they're exploring. The first one is to just start by conducting a literature review or some kind of commentary letter to an editor or opinion paper, updating the literature on the health benefits of spending time in nature, and then outlining barriers and ways to overcome them with 1 or more action steps from there was a policy statement around this issue that was put out by APHA in 2013. And then the second one is to write a policy brief that would be geared towards policymakers and insurance companies to push forward the idea of insurance companies actually reimbursing providers for taking time to talk with patients about spending time in nature and the health benefits of that. Their next meeting is scheduled at 1 o'clock Central Time on August 1st. If anyone is interested in getting involved in that subgroup, let us know. Our second subgroup is the Safe Routes to Park subgroup, and this one is slowly moving forward. We've been working with the National Recreation and Parks Association to take advantage of a survey that they conducted with their members on whether or not different municipalities around the country actually already have an existing Safe Routes to Park policy. And they had received some responses from about 26 municipalities, park and recreation departments that actually said that they do have policies. So this subgroup has been working on developing coding tools for those policies, and we have been collecting those policies from those communities over the summer, and we started testing out the coding tool that the subgroup developed with those policies. And then we're going to evaluate the strength of those policies and then follow up with some qualitative interviews with those same parks departments and municipalities to try and identify different facilitators and barriers around Safe Routes to Park policies. We also hold monthly meetings, so if anyone is interested in getting involved in that subgroup, just let us know. Our third subgroup is a park prescription subgroup, and we actually our main goal had been to conduct a literature review, which is complete, and a draft has been written up for publication, and we will also be giving a presentation on the results of that literature review this September at the National Recreation and Park Association Conference in New Orleans. And then once we kind of wrap up that literature review, I think we'll again be exploring different ideas on what to do within this group. We talked a lot about trying to potentially do some work around this when we had the dissemination and implementation meeting back last summer. So we do have a couple of ideas for some future studies within the subgroup. Our fourth subgroup is trying to develop a place-based audit tool, and so there's actually an existing tool for this that is currently being tested in Chicago as part of it's part of UIC's PRC's core research project. We're out auditing parks right now, and so we are also testing out this new place audit tool, and we're we're testing it for reliability, and we'll also be comparing it against EPRS and EPRS audit tool for validity as well. So that is also moving forward. And then our fifth subgroup that is in development is going to be led by Jake Bustad, and he's really, he wants to look at the parks permit system and allocation of public spaces to different organizations, specifically used by privatized adult recreation. And so that's one that we're still, it's in development, and we're working to kind of get that one up off the ground. And that's it.
That was great. Thanks, Sandy. And I know, I think Rich is on the line, so I didn't know, Rich, if you had anything to add to Sandy's update. I think she gave a lot of detail, but just in case, I wanted to give you a chance to give any more information.
No, I think Sandy covered it pretty well. I think that's kind of where we're at. Like you said, our next call is on August 1st, this Tuesday. So anybody with any interest in that project, we are kind of, like she's mentioned, just very at the initial stages here, don't really know exactly what we want to focus on. We have a few ideas running around, but we're trying right now to kind of focus our efforts a little bit more and get that more defined. So, yep.
Great, thanks, Rich. So I'll pause before we move on to the next working group to see if there are any questions.
This Jamie, I don't have a question, but you, Sandy, you guys put us really to shame. So I'm so embarrassed, but I'm very impressed.
No, Jamie, this is Keisha, not at all. We're just gonna say everybody's doing a great job. So, Sandy, you guys are being super. You got a lot going on. Great work, and it's nice to see that there's a new group sort of forming as well.
Yeah, well, I mean, maybe it sounds more impressive than it really is. I mean, Jamie, we've struggled for a long time to get these projects up and running, and it's just really in the last couple of months that they've kind of really been fully defined, and we've been able to kind of move them forward. So we're not. I mean, you got off the ground running. It's taking us a very long time to get these up and running. So.
All right. Well, thanks. But congratulations. Great work, team.
Yeah.
Any progress is good progress. Okay, so the next group that we are getting updates from is the Rural Physical Activity Group, and Christian is in a library in a quiet zone. So he sent me a note, and I'm going to provide the update for him. So the group that Christian is leading for the Rural Physical Activity is on kind of this concept of decision making, and they're looking to identify rural counties that stick out on the high side for adults meeting physical activity guidelines. And so they're looking to collect information from those communities about built environment decision making to support physical activity to see what lessons can be learned. And so they've been meeting monthly, except they took June off. They have found a manuscript that did some small area estimation that they've used to identify positive deviance in meeting physical activity guidelines among the most rural counties. And they're going to be piloting testing instruments in Texas with Renee Umstead-Meyer in the fall. And so their goal is to identify people, places, policies, programs that are working in the most active rural areas, so things like blue zones. Their next call is on Monday, and they're most likely going to be discussing abstracts to submit for ALR 2018. So if you are interested in that, I know they've been making quick progress in that group, but I'm sure that new members are welcome. So if you're interested in rural communities and want to participate in that, just let me know. If you contact me, I'll send you, direct you to Christian, and he'll send you that call information for Monday. And he said, bingo, join us. So they are still looking for people to participate in that project. So I think that's the main update for the Rural Physical Activity Group. Any questions for for myself via Christian, who can message us. Okay, with that, I'll turn it over to Lori to give the update for the Workplace Health Promotion Group.
Thanks, Amanda. So our group has been meeting fairly regularly. We have a first draft of our policies paper that's giving guidance to employers on integrating physical activity in the workplace. We have run into, so Kessler is an author on the paper, and so she's got to go take it through CDC clearance. We're hearing that might take at least 6 to 9 weeks. Just wondering if that could be expedited in any way, because we'd love to be able to get this paper off to the American Journal of, we're thinking about sending it to the Journal of Occupational and Environmental Medicine. So as soon as we get that CDC clearance and integrate any feedback, we'll be able to send that on. And then in conjunction with publication of the paper, we want to be sure to develop a policy brief that would be kind of a shorter executive summary of the paper. And so that's kind of a quick summary. Anything else, Amanda, that I should mention?
No, I think that's great. I think I did want to highlight the policy brief that they'll be developing to supplement the journal article, and that's obviously, you know, our focus on translation and dissemination and implementation. And so that's it's kind of the first paper that we'll be going through that process to develop. And obviously, we're fortunate that, Lori, you have quite a bit of experience in developing those and on the, you know, communication side with policymakers and advocates. So. But that's something that we, the coordinating center, is looking to support. So for everyone who is developing journal articles, we would like for, you know, the policy briefs to be a part of that. So what they did is Elizabeth is leading the submission to the journal, and she actually just reached out to the editor and let them know that they were planning to submit the paper and planning to develop this policy brief. And so giving them a heads up that it's something that they would like to publish in addition. And the editor was happy with that. So she was very supportive of doing that, and just asked that the brief was not published ahead of the publication. So I think that's something that's a good example of, you know, working with the journal editors in advance to publish stuff like this.
This is Tom. I will bug people on my side. I'm not sure how effective, but I'll at least make sure it's not just lost in the pathway somewhere.
Thanks, Tom. I really appreciate it.
Okay, great. Thank you for that. And if you, kind of on the next call for that group, they're planning to present the results of that paper and talk about next steps for projects. And so it's a good time to kind of join up with that group, since they're wrapping up one paper, but looking to the future to discuss additional projects. So if you are interested in workplace health promotion, let me know. I'm happy to add you to that listserv. So the last working group we have is school wellness, and I will turn it over to Hannah, and Eric has your slides to advance.
Okay, great. Thanks, Amanda. So I'm Hannah Calvert. I'm the new working group fellow for school wellness. For the past year, Hannah Lane has been coordinating the school wellness group out of University of Maryland. She's been doing a great job, and so introducing the fellow to the group has been a great way for us to coordinate the call logistics and check in on working group projects over the last year. So I just want to commend her for doing an excellent job there. Next slide, please. So over the past year, in terms of network development, we've established a professional development opportunity with the Working Group Fellowship, as I mentioned. So that's been a great experience for Hannah Lane, and will be for me. We've grown our network through a number of experiences, including hosting some of the school wellness roundtables at Active Living Research and Healthy Eating Research this year. We've continued to meet people in our monthly calls who've been engaging with us on and offline. And now we're about up to 130 members in the network, half of whom are practitioners, including representatives from Alliance for a Healthier Generation, Voices for Healthy Kids, AHA, Pew, and Action for Healthy Kids. And so we're really, it's seeming like it's really great growth over the last year in terms of adding more people. With bringing in both Hannah and myself, we've brought in some others from our professional networks to join the group. So it's been good. And I'll go ahead and go to the next slide. Oh, and I forgot to mention, since we're also a collaboration not only with PAPRN, but with PAPRN, the Nutrition and Obesity Network, which is another reason why we have some good productivity, since we have overlap between members of both of those groups. And so in terms of the products we've been working on, I think this is an ongoing project, but the Public Measures Repository of methods to measure wellness policy implementation with some folks over at the Red Center. And the goal, I think, is still to be submitting that in late fall. We have a systematic review of tools for measuring the school environment in terms of healthy eating and physical activity, so school audit. That audit process, or the coding process for those articles, is ongoing. And we have a goal currently to submit in October. And I'm not sure if we have a journal identified for that just yet, but that coding process is starting, or is going on as we speak. We have been in collaboration with Keisha with the dissemination and implementation on walking and walkability. The APH, is it the American Journal of Public Health submission, and we're still working on that. And we had the opportunity to connect with a few people at Active Living Research this year, including Jordan Carlson, who we've now started to be looped in on a project of a review of classroom physical activity, like classroom-based physical activity methods, I guess you could call them curricula. So we're in the process of coding materials for a manuscript for that. And lastly, also a collaboration with Sarah Sliwa from the CDC, which arose from ALR this year, where we're looking at some national data on out-of-school time, healthy eating and physical activity policy in a nationally representative sample of schools. So that's kind of a snapshot. You can go ahead and advance the next slide. So this is basically the last three that I mentioned are more on the PAPRN side in terms of our collaboration, while the first two are with PAPRN members more so. Okay, and you can go to the next slide. So in terms of our future goals, the transition to a new working group fellow, which is myself, is a little bit ahead of schedule since it's not quite August, but I'm grateful to Hannah for making the process really easy. We're continuing to grow and engage our network with our monthly calls. Our next call is on August 8th, and we'll have Lauren Au from the Nutrition Policy Institute. And if anyone from this call has any recommendations in terms of speakers, we're currently recruiting for the rest of our calls this fall. And again, we do take people who are practitioners, such as Department of Education or any other kind of state department, government department, as well as academic-based speakers. And yeah, we'll be continuing to work on our ongoing projects. And we'll be speaking about this on our next call, which is a research brief in process on school wellness teams. So we'll be reaching out to members of the network soon to solicit more participation on that. And you can go to the next slide. So that's our contact information. Again, I'm Hannah Calvert, and our previous fellow was Hannah Lane. So I just want to give a shout out to her for doing an excellent job again over the last year with all the work that she's put into the group. And I think that's all that I have.
Great, that was wonderful. Thank you, Hannah. And I'll pause there to see if there are any questions for Hannah or any of the other working group leaders.
Hannah, this is Jamie Shrieky. Thanks very much for that. We actually have a couple of things from our school wellness policy cooperative agreement that would be of interest to that work group. So I can communicate maybe with Lindsay and see what would make sense for doing some presentations to that group on our new, FYI for everyone on the call, if you haven't seen, we released 2 new reports. One was our latest nationwide district report on district wellness policies, and our first ever state monograph that covered 9 years of data that includes PE, PA, staff wellness, along with all the nutrition and things like that. So that might be of interest, Hannah, but then I also have some linked analyses linking our policy data with SNMCS implementation data. So maybe we can coordinate and see if there's some opportunities there for collaboration.
Yeah, Jamie, that would be excellent.
Jamie, this is Lindsay. That would be great.
Oh, hi, Lindsay. Obviously, you know about it.
Yeah, we should definitely talk. And, you know, we say this on most of our calls, but we say, anyone who wants to present, we would love to have you present. And I'll say that here too. So we'll definitely, you know, Jamie, we'll get some stuff on the calendar. But as Hannah and I are sitting down working out sort of our next year's calendar, we have lots of opportunities. So open invitation to anyone on this call too. If you have something you'd like to share with our group, we would love to have speakers. So let us know.
Great. Thanks so much.
Great. Any other questions or comments for any of the working group or project leaders? Okay, so I just wanted to take the opportunity to thank everyone for not only giving updates today, but for all of the work that everyone's been doing. I know at times it's felt like things have been moving slowly, but I think based on today's call and the activity spreadsheet that Eric highlighted, you can see that there is stuff happening, and we've been doing some great work. So I just wanted to take a moment to acknowledge that, and also to, appreciation to Tom for, continuing to be our champion at CDC and highlighting all of the great work that you've been doing.
Great, thank you, Amanda. This is Keisha, and I will thank you again for all of the great work that you've been doing to support the working groups. And let me also thank all of the working group leaders and members who have, excuse me, made time to move these projects forward. And it's really nice to sort of see and hear about how things are going. And again, I think this is just really terrific for Tom and his efforts at the CDC, and helps make it easier for him to be a champion when we have things going on. Thank you again to everyone. This is the time in our agenda where we like to have what's called open mic, where we allow time for for announcements or for questions from the group or feedback on anything. I want to mention something that Chris Calitz had sent. He's not able to be here today. That he sent to several of us who are on the call. And just that the American Heart Association is launching a workplace health science and implementation research track at their 2018 Lifestyle Scientific Sessions. And they also have a workplace health standalone abstract category for the first time. And so that conference is in New Orleans from March 20th through 23rd. And so we will, with the notes, send out the link to submit abstracts for that meeting, and those are being accepted through October 11th. So we'll have that in the minutes, but really a great development for AHA. And for those of you who usually attend that meeting or are planning to attend, this could be a good opportunity if you're doing stuff around the workplace. So let me pause and see if there are other comments or questions or announcements that people want to share before I make a couple of other announcements on behalf of the Coordinating Center. Okay. All right, hearing none, let me remind everybody that we certainly can send things out if, as we're preparing for a new upcoming school year, for those of you at academic institutions and you have opportunities or are looking for students, this is a good way to try to find somebody. who might need a project to work on as part of their degree program. And so please let us know if we can get things out to everybody. Before we wrap up, I had two announcements from the Coordinating Center. The first is that we already have our speakers finalized or available for our September call, and we are thrilled. We have two speakers from the Prevention Research Center at WashU in St. Louis, Alexander Morshed and Rachel Tabak, I think you said her last name, and they're going to be talking about translating public health research for policymakers and advocates. And this is, we're really excited for this particular upcoming session. And, you know, we have reached out to NoPrin, so I think they're going to advertise it broadly as well to their network. And we're really excited to hear from Alex and Rachel in terms of the work that they're doing around translating public health research broadly to policymakers and to advocates. And so those of you who are doing work in this area and who are interested in learning more, I encourage you to make time in September to participate in that call. And finally, before we wrap up, let me just make an announcement from the Coordinating Center that I'm sad to say that this is the last call for one of the members of our Coordinating Center, Marianne Bailey, our last call as a member of the Coordinating Center, Marianne Bailey, who has really helped to compile the notes and has really been working behind the scenes. And some of you may have heard her voice or have met her, but just want to thank Marianne, who's moving on from our group to a different position here at Hopkins, and just wanted to publicly thank her for her time and support since the inception of PAPRN Plus. So thank you, Marianne, and thank you also for taking notes today and helping us to get those out, and just really appreciate your support over the last several years.
Thanks, Keisha. It's been my pleasure.
Let me interject that thanks again, Marianne. You've been a real big help, and we're going to miss you.
Oh, thank you. Appreciate it. It's been a pleasure to be a part of the PAPRN Plus Network and Coordinating Center. So thank you.
Yeah. We will certainly miss you, and you know, I'll personally miss you because we've been working together for so long. So with that, let me again thank everybody for making time today. And
Keisha, I had one last question. Sorry.
Yeah. No, sure, go ahead.
I know we had this time period scheduled, I think, through this meeting. Are you going to revisit the time, or are we keeping it for the fall? I didn't know if you were reconsidering anything, you know, with people's fall schedules changing or whatever.
Yeah, good question. Thank you, Jamie. You know, we can certainly revisit that before we do have our time set for the September call, but beyond that, you know, we periodically, like twice a year, have checked in about times, and so we can do that again and see if there's another time that works for folks. It's funny, every time we've done that, the same time continues to be the #1 time for people, but we can, but I suggest to sort of revisit that. So I know our September call is set with our speakers, but we can certainly look into finding another time beyond that. So thanks for that suggestion. So I'll put publicly just ask Eric or Marianne in the notes to, we'll craft some language about that. Great, thank you. Anything else before we wrap up today? All right, well, thank you everybody for a great call. It was wonderful to have such wonderful participation. And I hope everybody has a terrific summer. And we look forward to being on the phone together in September. So take care and have a very safe and active summer and a great Labor Day, since we won't touch base until after that. So of course, until then, we'll be sending email updates with the minutes and notes. And if you have other announcements to share with the network, please send them along.
Great.
Thank you again.
Thanks.
Thanks.
Take care, everybody.